According to the American Cancer Society, this year alone, more than 30,000 people in the U.S. will be diagnosed with multiple myeloma, a blood cancer that originates in the bone marrow, and more than 12,000 people will die from the disease. As science advances, cancer experts are exploring potential ways to work directly with the body's immune system, also known as Immuno-Oncology, to help fight multiple myeloma. California Life's Kaori Takee welcomes Dr. Berenson to our studio.
Hi, I'm in the studio today with Dr. James Berenson, talking a very important subject, multiple myeloma. Could you tell us a little bit more about yourself, doctor?
Sure. I've been doing myeloma work for about 30 years, both in the lab and clinically. I've done a lot of clinical trials, including with Bristol Myers Squibb, that makes one of the products that we're working on called Implicity.
And what can you tell us about this product?
Well, Implicity is an antibody that helps harness the immune system, so-called new way of treating cancer called Immuno-Oncology. And what it's been shown to do is boost the effectiveness of two other drugs that have been used to treat myeloma effectively, called Revlimid and dexamethasone. And recently, data at the European hematology meetings has shown that when you add Implicity to the old gold standard, Revlimid and dexamethasone, you greatly extend the time during which the myeloma is under control. Myeloma is a bone marrow-based cancer. It occurs in plasma cells. It's a type of white cell. And since it's in the bone marrow, next to the bone, these patients commonly get into problem with bone problems like fractures, bone pain. They also may develop anemia, and sometimes the kidney's impacted as well.
Are there any symptoms that people can notice that they might have multiple myeloma?
Well, they're not that specific, but it's a good question. Since it affects the bones, it's bone pain or a fracture that may occur for no good reason, not say from a lot of trauma, but you just fracture suddenly. That can really be a tip-off that your bones are too thin. You may have myeloma. Sometimes the kidneys are impacted, so therefore you could have some nausea, feel tired. You can also have that happen from anemia, which can occur. But a lot of times it's found simply on routine blood testing. Your protein's level's high, and a lot of that protein's antibody, or you may present with a low blood count, you're anemic, or maybe just a routine kidney test, your kidneys are off, and then further inspection, you're found to have the myeloma.
Can be perfectly fine and once you're treated for myeloma?
Well, I won't say it's necessarily perfectly fine, but I always like to say the goal of my treatment should be not only to get rid of the myeloma, but it really should give the patient the longest life possible with the least impact, not only from the myeloma, but our drugs. And we often forget that drugs have side effects. And the good news is Implicity has very limited side effects compared to a lot of the other drugs we use. In fact, I think they're really limited, and I've done a lot of large studies on this. And basically, about the only side effect is a rare patient can have an infusion reaction, but they're not severe like allergic reactions that would make you go to the hospital. They're pretty limited in their scope.
Well, thank you so much for joining us into the studio, and good luck with the journey. And to learn more, go to californialifehd.com or your website.
Or if you want to learn more about myeloma itself, you can go to imbcr.org. Or if you want to learn more about Implicity, go to implicity.com. You'll learn all about the drug, its side effects, and its effectiveness, and how it's given.
Thank you. Thank you so much.
Thank you.
Thanks, Kaori.